Excuse me, Mr. Geo.
Yeah, what's up?
What does it take to become a champion?
You gotta dream, you gotta think, you gotta act, you gotta ball, you gotta bleed, and most important, you gotta believe.
You gotta dream
like a champion, think like a champion, act like a champion, say it,
I'm a champion.
soar like a champion, breathe like a champion,
look in the mirror and believe.
You're a champion,
You gotta dream
like a champion,
think
like a champion.
You're tuned in to IChampionHealth Chats, the podcast for amplifying community voices and advancing health for all in Lexington, Kentucky. Each episode connects you with local champions who bring powerful stories, useful tools, and fresh ways we can show up for ourselves and others. Let's lock in and learn how we can champion health together. All right. Well, good afternoon to all of our listeners and viewers, and welcome to another episode of IChampionHealth Chats. My name is Gerald Gibson. I will be your host today, and I am a violence prevention intervention specialist focused right here in the Lexington, Kentucky area.
And I'm Jakob Hester. I'm program coordinator for IChampionHealth, and we are a community-engaged health initiative here in the UK College of Education.
All right. And today we have a special guest joining us today, Mr. John Moses. How you doing, Mr. Moses?
I'm great. Thank you so much for having
Well,
me.
thank you for coming, John. And John, can in the beginning, can you share a little bit about, what you do personally and within our community? What do you do?
Sure. So I'm currently employed at the Lexington-Fayette County Health Department.
Okay.
I'm the team leader for harm reduction services, which provides our syringe exchange, naloxone distribution, HIV and hepatitis C testing and referrals to treatment. Mm-hmm. And the biggest thing that we do is that we allow people who use drugs to come in and have a safe space and provide services in a way that is empathetic and without coercion and without judgment. This is super important to me because I come from a family of alcohol and drugs, mm-hmm. and my immediate family all have passed due to alcohol and drugs in some way or another. My father was murdered here in 1995. He passed out drunk, and his wife of 6 weeks set the trailer on fire and walked out. And it was that moment that I came back to Lexington after being in Atlanta for many years, using cocaine every day. And when I got back to Lexington, it was time for me to get it together. Yeah. And we took care of my father's funeral. And around that time, I met a man who has been the joy of my life. He was working at the health department. His name's Mark Johnson. He was a social worker by trade. He had also had a major loss around that same time, and we kind of grieved together and became friends. And before that, we were involved in a relationship. He told me I should go to the health department and apply for a job. Mm-hmm. I hadn't worked any real job in many, many years due to my addiction. And I thought, well, God, they're never going to hire me at the health department. Right. I don't know how to do anything, I'd never touched a computer at that point, and that was in 2004 by the time I applied for a job there. But they hired me. And before I left for Atlanta, I was a great student. I attended the University of Kentucky right here in Dickey Hall, studying early childhood education, but I never graduated. Yeah. And I needed to work, and so they hired me, and my first job at the health department was to swipe your insurance card and put your chart in the door. Mm-hmm. And I did that for about 2 years, but I was absorbing everything I could about the health department. Yeah. And so now I've been there 21 years. I've worked in many different positions, but it all led up to what I'm doing now. In 2014, the commissioner of health at the time, Dr. Rice C. Leach, he approached me and wanted me to go to a conference in Asheville, North Carolina. And I thought, this man is crazy. It's going to be medical doctors and nurses, and I don't know any of that stuff. But he said, no, go. I think you'll get a lot of good information. And he had great insight, because when I got there, it was the national conference for the Harm Reduction Coalition. And it was people who used drugs, people who did use drugs, people who loved people who used drugs. And so I was right in my element, and I thought, oh my gosh, this is what I've been waiting for. And so I took in all of this information about how to work with people who use drugs to get better health outcomes. And when I came back, we didn't know at the time, but very soon after that, in the winter of 2014 going into 2015, there was a major HIV outbreak in Austin, Indiana, where there were over 220 new infections in a town of 4,000. Entire families were becoming infected because they were sharing needles. They were injecting a drug called Opana, and the CDC got involved. Mike Pence was the governor of Indiana at the time, and he had the courage to lift their ban on syringe exchange to get this under control, meaning that we could give somebody a clean syringe, about 10 cents, and prevent a $400,000 HIV or hepatitis C infection that somebody's going to have to deal with, which is probably going to be Medicaid, which is probably going to be your tax dollars. And so that's kind of how that started. After that, the federal government lifted their ban on syringe exchange. Kentucky did the same. And on September 4th, 2015, we opened the second syringe exchange in Kentucky. That was eye-opening, and we thought we were ready, and we worked really hard to learn as much as we could so that we would be successful. We knew we would only have one chance, or the community would shut us down. But it was really the financial part that we could sell with the City Council, Board of Health. And so we opened, and we thought hundreds of people would just flood into the health department saying, I used illegal drugs and I'd like to get some needles. Yeah. And we had 9 come that day, and we were like, dang, 9 people. But then we thought, well, 9 people did just that. They came in and admitted to something and trusted us enough. So how we treated that person that came in that day was paramount, because they were going to go tell their friends and family, hey, they're nice guys. They are just there to give services. The police aren't there. It's not a setup. And it grew exponentially after that. Yeah. And after a few weeks, we had to move out of the small room we were in and move into a much larger area. And what I learned through all of that is that people who use drugs are people. They're humans. They're not addictions. They're not all of the stereotypes that we think they are, and it's affecting our entire community.
Wow, that's heavy, man. But glad that you made it through a lot. I mean, that's very amazing, your testimony so far. So
yeah, what do those numbers look like now? You said kind of the opening, it was nine individuals coming through in that first day, or that first week, and then what does that look like now? And it's been 11 years, I guess.
Sure. We just celebrated 10 years, September 4th, and the numbers have been up and down, depending on what's happening in the community, what's happening with the illicit drug market, and COVID, of course. And so right now we average anywhere from 700 to 900 people a month that come through. Over time, since we opened, we've had almost 11,000 unique individuals make over 120,000 visits to our program. We've exchanged over 5.5 million needles. Those are needles that got disposed of properly, that didn't end up in a park or in a trash can or on a playground. They are disposed of properly, and as long as they bring back the needles we give them, then they can continue, doing that as long as they're using. We provide some other supplies with that as well. The HIV and hepatitis C testing and referrals to treatment, that's contracted through UK, through Target 4. They provide all of those services for us, and they've done over 4,000 tests during that time. Mostly HIV. Most people who are using needles already know their hepatitis C status, mostly positive, and they're aware of that, but we can make referrals to treatment for that. But the number that I'm most proud of out of all of it is that we have a 92.7 return rate on our needles that we give out. And so we know that they've bought into the program, and we are really protecting the community in that way by providing this service. We do a really good job on their first visit, making sure that they understand the rules, that this is your program. And the only way it can work is if you follow the rules. We're going to respect you and you respect us. And we're able to get them to buy in to where they know they're not going to go inject in the bathroom. They're not going to deal drugs out in the parking lot.
Right.
They're not going to fight. They're not going to fuss. And to be honest, I love these people. I love these people when most of the people we see are using methamphetamine or heroin, mostly fentanyl now, opioids, and things like that. I know how somebody's going to act when they take those drugs. And so I know how to behave around them. Alcohol, on the other hand, which, by the way, kills way more people than opioids ever have, you don't know what you're going to get. Am I going to get, I love you, man? Or am I going to get violence or ugly or whatever? And so I always like to remind people that alcohol has had a much worse effect on our country than opioids ever have. The other thing that I'm real proud of, so our program, we work in a way that when they come in, we have big signs and we say it, welcome, we're glad you're here. And we really are, because people who use drugs, maybe this is the first time they've touched a healthcare system in a really long time, and they're nervous about it because they don't go to the ER unless it's absolutely necessary because of past history of being treated as a drug seeker. They don't do primary care. They don't do dentist, all because we have this stigma associated with it where our professionals tell them you have to stop using drugs or we can't provide you services. And so we really work hard to link them to services with providers who will see them and work with them. But by providing the syringe exchange, Dr. Leach always said it's not about the needles. That's just the lure we use to get them in the door.
Right.
And people who use syringe exchange programs are 5 times more likely to seek treatment, 3 times more likely to reduce drug use or stop altogether. And so we know the longer we can keep them in the building, the more services we can provide. And so we provide a warm space when they come in. Welcome. We make eye contact. We smile. We say, have a seat, have some coffee, charge your phone. We'll do the exchange and hang out for a bit. Do you want a journal to write some things in? We've got coloring pages on the walls, and we try to engage them in things to keep them there so that they get comfortable and we can build that trust. And over time we do. And so without ever pushing them towards treatment or coercing them or trying to trick them into it, we just tell them on the first time, hey, we've got all these services that I'm going to tell you about. And every time you come in, all we're going to say is, do you need to see a counselor or get tested today? And when you're ready, you let us know. And they do. And by doing it this way and being patient and knowing that the process will work, we've gotten over 680 people into substance use treatment without trying.
It's amazing.
Yeah.
Yeah. So I couldn't be more proud of this program. It has changed lives. Our medical director at the health department right now, every time he talks about this program, he says that it's not that you're just saving the life of someone that is using drugs, but that you're changing family trees. And I have to believe that, because when you pull somebody out of their family tree, that affects the entire family. And it's just amazing work. It's very gratifying. And I didn't know at first, but I went through a lot to get to where I am now. And I finally realized that it was all the plan. This is where I was supposed to be, and this is what I was supposed to be doing.
Yeah, that's what I'm really curious about, is like the level of trust that is required to be able to do something like that is a lot, right? Like to have people have that trust to come in to an entity like a health department and do those exchanges and be receptive to messages and all those types of things. I'm curious about like your path to that point and how it's helped you, I guess, maybe.
Sure. So when I was young, I was guilty. I would be with my mother, and we would see somebody on the corner or on the street, and I'd be like, Mom, hold your purse. Let's cross the street. They're going to ask us for a quarter. They're going to ask us for a cigarette. Don't make eye contact. And that's how it was. And then I got to Atlanta and had a cocaine addiction. And suddenly I was that person, and I was invisible, and nobody was making eye contact, and nobody was smiling. And I felt humiliated, and it was the worst thing that I'd ever felt in my life. And so when I came back to Lexington, when I started in the clinic, just working as a clerk, I knew that I wanted to treat people differently than I had been treated. And I know that stigma that's associated with it. When I would go to a primary care checkup or a doctor's appointment in Atlanta, he would say, John, you've got to stop smoking cigarettes. And I'd be like, I know, I'm going to. I really do. The next time I see him, no, really, you've got to stop smoking cigarettes or this is going to kill you. I know, I'm going to stop. And then one day I was having a bad day and I had an appointment. And I was like, I cannot even bear to listen to him say that again today. And I'm just going to reschedule this one appointment. And then 4.5 years had gone by since I'd seen a doctor or a dentist. And so my life experience really groomed me for what I'm doing today. And being able to have empathy for people. You have to teach children at a very young age to have empathy. You have to get in the floor and show your feelings and your emotions. Teach them to share. Teach them to understand other people's feelings. Because if you don't, they're going to grow up without empathy. And we have so much in this country right now of people who lack empathy. The worst for me, though, is teenagers, because cell phones, social media, and maybe not being taught empathy as a small child, we have teenagers who don't know how to communicate. And when they don't know how to communicate, they just say, whatever. And when I hear a teenager say whatever, it goes all the way down my spine, because I'm like, it's not whatever. And it's the same with it is what it is. That sounds defeatist to me. It doesn't have to be it is what it is. If you're willing to put in the work and take the challenge and educate yourself and help to change the minds of others, it doesn't have to be it is what it is.
Yeah. Wow. And that is definitely loosely said. Everywhere we go,
Sure.
it is what it is, man. You know, to put it in those terms, man, it does sound like defeat right there. So what are some of the goals that you have for the community, man? And, you know, over the next 3 to 5 years, man, what is the hope that you want to see in the community?
Sure. So the illicit drug market has changed, is changing constantly. And so what I'm hoping for the next 3 to 5 years is that we can get some of the addiction and homelessness and things going on that are happening, that we can get those under control a little bit better. The overdose rates here in Lexington and in Kentucky as a whole have been up and down over time. We were doing really good until carfentanil showed up in the drug supply. Before, and carfentanil is an analog of fentanyl that's just a lot more potent. And we saw a lot of deaths. And then Narcan started hitting the street, and the drug market changed and pulled back the carfentanil a little bit so that people weren't dying at such a high rate. And I think they realized dead people don't buy more drugs. And so it's just, we've seen this shift in the drugs that people are using. And so with all of those deaths, also over time, we've seen that some people are switching their mode, going from not injecting, but to smoking it instead. Some people have moved from the opioids and heroin to methamphetamine because it's a completely different drug, but fentanyl is killing people. And when you don't know what's in the drug supply, you know, you just don't know. And so you think, yeah, I can do this much of this drug. I've been doing that forever, but you're not sure that's what's really in it. And so what we're seeing are things like xylazine, which is a a large animal tranquilizer that's for veterinarians to use. People are injecting that. We are seeing a rise in nitazines, which are older opioid type medicines. We have seen these products mixed in with fentanyl into everything, into coke, into meth, into heroin. Fentanyl and xylazine mixed together can be deadly. And we just have to try to stay on top of this. And so the best thing we can do is to educate the community, but also educate the people who are using drugs to slow down on how much they start with. You can always do more drugs. You can't take them out of your system, though, once you've taken them. And we're just trying to save lives. And so we have a big whiteboard. We just started allowing our participants to write up on it things they've seen or how they felt when they did different things. We are also partnered with UK Harm Reduction Hub, which is testing some of our syringes to see what illicit drugs are in them before we get them discarded, so that we can tell our participants, hey, we're seeing xylazine here in Lexington. It's being found in the needles, or fentanyl, or nitazines, or any number of things. It's a pilot going on right now in Louisville. They just added us on last month, so we don't have any results back yet, but they pick up our syringes this coming Tuesday, and within a couple of weeks, we'll be able to tell our participants what's in the drug supply so that they can make better choices. Our whole program is just about positive change, and that's what harm reduction is. Any positive change. You wear a seatbelt, that's harm reduction. Car seat, that's harm reduction. You smoke only on the weekends instead of all week, that's harm reduction. And that's all we want from our participants. We want them to not share needles, that's harm reduction. We want them to be aware of the drugs they're using and just make better choices about it. We, again, don't harp on, you've got to get off drugs, and that's not our end goal. Our end goal is to help them be safe, but give them the autonomy to make their own choices and to be able to decide when they're ready for treatment. We cannot arrest people over and over and over and expect that that's going to take care of their problems. We cannot force them into treatment. What we can do, though, is be compassionate and offer an ear and a safe space so that when they're ready, they'll be able to make that choice on their own. And that will also eliminate this idea that, yeah, people have to go to rehab 5, 6, 7 times before. In other words, not if you have a good plan and you've made it and you have people who are going to work with you to really find out what's going to be the best treatment for you. And we are ready to do that as soon as they are ready. Because they have to have that autonomy. It has to be their choice. And if we try to push them into anything, they're not going to come back.
It's
So
like
go ahead.
it's like working with folks instead of working on folks, which I think is a nice
Absolutely.
distinction, especially when you're thinking about sort of that empathy and then that actual compassion that you're showing and things like that.
And
Like
people can't understand that. Community can't understand a lot of that. There are all these myths surrounding what we do, that it causes more people to use drugs, that there's going to be more crime or more needles in the street. But all of that is the complete opposite. Our program is protecting the community and our participants in a way that is compassionate. And it's hard for people who are results oriented, that want the results right now. We got to get out in the street. We got to do it. We want metrics that we're going to increase this or increase that. For one, I don't want to increase our participation. If our numbers go up and down, fine. But to have a goal of increasing participation by 10% means that more people are going to have to start using drugs, or we may be missing a segment of the community. So a lot of the outreach that we're trying to do involves taking these services, and that's what harm reduction is, taking it to them, meeting them where they're at. And that's difficult because everybody is all for this program until it's in their neighborhood or it's in their backyard. And so it's a very slippery slope we go down when we are trying to provide this work. So yeah, it's just amazing that we have managed to get so many people in the city to trust us. because health departments and healthcare aren't always trustworthy. And I'll say this, we've had some, so overdose deaths spiked during COVID. People were more isolated. Some people returned to drugs. Some people started drugs. It was hard for me to be in front of the same person that I'm married to now 24/7, can't go to work. And to the point where you're looking at them like, if you just keep breathing, I'm going to have to choke you.
Right.
Excuse me. But so overdose really spiked. But we've managed to bring that down. And Narcan, naloxone, brand name Narcan has been a huge lifesaver for so many people. But these drugs that are on the street now, it's taking multiple doses of this stuff to get people back if we can. And it's really frustrating. But we just want to provide as much education to the community to get them more on board so that they can understand what we're doing and see the success that we have. But you have to be patient and let the process work. And you have to believe in harm reduction, that people have the right to make their own decisions. And given the right resources, they will make those decisions over time. And you just have to let the process work.
Yes, sir. I mean, you've mentioned so many different drugs that are out there, man. You know, I'm old school, so you know, I can only relate with the old school type drugs, man. But
weed,
there's so
coke, and
many
heroin.
things. Yeah, I mean, you've mentioned a whole lot of different things, man. And although you know we're talking about harm reduction and stuff like that, and the dangers of these drugs. John, what are you most grateful for, though? You know, seeing all these things, having lived through all of these things, what are you grateful for?
Sure. I'm grateful for life.
Okay.
Man, I came from a family that was using alcohol and/or drugs. As a gay man, was living in Atlanta using cocaine during a time when everybody I knew was infected with HIV, and they were dying. And all of my friends were dying. And we lost an entire generation of beautiful people, artists and authors and professionals and just so many different people. And over time, I've felt a little bit of survivor's guilt come with that.
Yeah.
Why me? I was doing the same thing that everybody else was doing. But it turned out, that there was a greater purpose.
Yeah.
And so just the fact that I've been able to survive the traumas that I've gone through in my life and the struggles that I've had and have come out on the other side, being able to provide compassionate service to a community that is often left behind, is what I'm most grateful for, that I've lived through it and now can use that information and that passion to try to help others who are going through the same thing.
How do you take care of yourself? I mean, seems like you're showing up for a lot of people.
Sure.
But how does John take care? John?
Absolutely. So I show up for the community. I show up for my staff. I don't like when employees get stuff piled onto them. You've still got 3 minutes in the day that you're not using. Let's pile this project on you, or let's do this, let's do that. And I make sure that they're practicing self-care as well. But the thing I did 3 years ago, I was at a very high level of stress. I was driving through Atlanta. Somebody said something on social media. I had road rage. It was political. I pulled over and my thumbs were going as fast as I could to respond to something. And I stopped and I was like, if you send this, somebody's going to come find you. You're going to be arrested for this.
Right.
And I put the phone down and I vowed that I would never get on social media again. And I got rid of Facebook, Instagram, TikTok. I got rid of all of it. The only thing I kept was Messenger so that I could keep in contact with my family and friends. Occasionally when I'm on Messenger, something will pop up because it's attached to Facebook. But I may look at something, but I'm not posting. I'm not looking at political ads. I got so overwhelmed by marketing, the robocalls, the junk mail, you say something in front of Siri and suddenly it comes to you as a text and an email, and you're getting phone calls of wanting to sell you what you were talking about when you didn't even know it was listening.
Yeah.
And so I just had enough. And it was the best thing I ever did because I lost weight. I wasn't on the couch scrolling all night long, looking at the TV and my phone at the same time. I found a love for the things that I used to love, gardening and crafting and sewing and just so many different things that I'd completely forgotten about because I was addicted to my phone.
Wow.
So Gio and I bond over music. That's one of the things that, like, I know is a common, self-care tactic for the two of us too. So we've been working on these curated playlists, and something new we're doing with this season is actually asking our guests to kind of give us some inspiration too. So what's a song or an artist you turn to when you need a reset, when you need like that pick me up or maybe a calm down?
Sure. So everybody needs that. And I gave up TV and radio during this whole process of getting away from marketing. So I just watch on TV things that are recorded that we can fast forward through the commercials or watch Netflix, right?
Yeah.
But it's really an easy question. Sade, the music, some of it,
Sade?
What?
You say Sade?
Sade. Oh my God.
That's
I
my
can listen to that 24 hours a day and just feel rejuvenated and feel like I can conquer the world.
Yeah.
The song Your Love is King. Oh my
Man,
God.
that's my highway music right there, man.
Exactly.
Yeah,
Exactly. It gives me this energy, and her music is mostly slow. So it's not that I'm looking for
Beautiful.
loud, high beat, high energy music to make me feel better. It's that smooth sound that she has and the lyrics, and it just keeps me focused and calm and centered. And I feel like I can do anything.
Yeah. Amazing.
That's
man.
one I've been diving into lately. Sade actually made it on the original playlist that we had too. So that's awesome. Yeah, that's one that I like to hear as well. I mean, it's definitely like you said, it's kind of got that calming sort of melodic element to it that really just sort of draws you in really easily.
Yeah. Well, John, your testimony is amazing, man. And, we have listeners, we got people watching this. And what advice would you give our listeners and viewers, especially our young people, man, moving forward in life? What is something that you can say that will encourage our community?
Sure. I think that people can make the biggest difference in their community and in their lives through connections, through empathy and compassion, and knowing that where you are now could change in 5 minutes, in a week, and that tomorrow is not guaranteed, and that the energy that you put out into the world is going to come back to you. And so I would encourage, especially our young people, to get to know one another, know your differences, know your strengths, learn from that, and be respectful and empathetic to people who have taken a different path from you or are different in any way from you. One thing that I failed to mention earlier that I definitely want to get in is that we talked about overdose rates going up and down. And the past couple of years, we've had a significant decrease in overdose deaths in Kentucky. It is good. But when you look at the data, what they don't tell you all the time is that African-American men, those numbers have gone up. And while the rest of the population has gone down. So one big thing that I want to work on is somehow bridging that gap between the health department and our African-American community that can build some of that trust back that was lost because of Tuskegee and all kinds of things, the drug war, everything that's happened over my lifetime has put us in a position of inequity that breaks my heart.
Wow. Well, John Moses, ladies and gentlemen, man, listen, John, we want to thank you for just sharing your journey, and you were definitely a blessing to our community, and we wish you well on your journey. Again, thank you all you listeners and viewers for tuning in to another episode of IChampionHealth Chats. Again, I'm your host, Gerald Gibson. Joining me today was my co-host, Mr. Jakob Hester. And again, you can visit us online and make sure you tune in to IChampionHealth Chats. Thank you much, John.
Thank you.
All right. God bless.
Thanks for tuning in to iChampionHealth Chats.
If something you heard in this episode spoke to you, don't forget to follow us and share it with your community. You can find us on social media at IChampionHealth or email us at iChampionHealth@uky.edu. This season was paid for with funds from the Kentucky Opioid Abatement Advisory Commission by and through the Office of the Attorney General. The opinions and recommendations expressed in this podcast are those of IChampionHealth and the guests. They do not necessarily reflect the views of the Kentucky Opioid Abatement Advisory Commission or the Office of the Attorney General.